Okay, so let's talk about day 11, basically 10 or 11 to week 6. Not a lot changed in that time. I got my bands loosened on day 10, and I still had to keep the splint in until week 6 to keep my bite in place. My nurse practitioner told me the food that I ate on day 10, some of it would still be in my splint on day week 6 when I got my splint out, which is pretty gross. Like I said, the smell that I had in my mouth, there's like a smell taste, did not completely go away until I had my splint out for a few days, because I was kind of holding just like food debris and things in there. I went back to work after I got my bands loosened, so it was like day 12 or something like that. It was kind of difficult. I was tired because I couldn't eat very much, so I was still just trying to conserve energy. But I made it through, and I worked all the way through week 6, and I'm still working my normal hours. So that was not that bad. Patients would ask me, I'm a nurse if you didn't know that, patients would ask me, what's that thing in your mouth? And they'd make comments about how skinny I was, because I'm, normally skinny, but I had lost 11 pounds. So I was really skinny, like as skinny as I have been since like junior high. So yeah, I was really, by the end of 6 weeks, I was really tired of soup, like really tired of soup. And I have other food like mashed potatoes and macaroni and cheese, which are my 2 favorite foods. But after eating them like constantly for 6 weeks, I was definitely ready for something else. I started eating pancakes, which I'm not a big fan of, and I would just soak them in butter and syrup so that I could mash it up with my tongue, and that actually worked really well. I also ate grilled cheese, and I made it really soggy, which I have a video of that too. And basically I made it soggy enough that I could break it up with my tongue, so I couldn't chew. After 4 weeks I was allowed to chew, but the splint covered my top molars, and it was very bulky, so it made it difficult to chew anything even if I wanted to. What else? I was tired through this first 6 weeks, just like I said, because my caloric intake was not really there. So I didn't really exercise. I just didn't have the extra calories to spend because I was still losing weight. I lost weight until I got my splint out after 6 weeks. And then I slowly have gained weight back, but I've still only gained back maybe like 6 pounds at most. And I lost a total of 11. So, yeah, but weeks 1.5 through 6 weren't that bad. I did end up blending pizza once because my friends were over and they were eating pizza and I really wanted some. That actually wasn't that bad. It tasted like pizza. I just blended it with milk and pizza sauce. It's pretty good if you're looking for something to eat when you on a soft diet. Also, I got a 7-layer burrito from Taco Bell without lettuce, and I blended that, and it just kind of tasted like beans. It wasn't anything too weird. Ken thought it was weird, but I made him try it, and he said it tasted like beans too. My swelling from day 10 to 6 weeks did decrease, but it wasn't like super drastic, because by day 10, 11, they said I was looking pretty good, and my swelling really wasn't that bad at that point. So that was nice. Today is day 13 post-op. The last 2 days I spent playing poker at the casino. That's why I did not do any updates, because I was there all day. But my energy level is, I would say, back to normal, or pretty close. I've actually been a little more productive recently, because I have to get up and eat before I can take my antibiotics. And I've had some things to get done that I wasn't able to do my first week and a half after surgery. So I am getting ready to go out and get Tyson, my little puppy. Oh, he's right here. Hi, Tyson. Say hi to Tyson. Hi, Tyson. Aww. We have to go get his nails cut. I need to go to the bank, and I have a doctor's appointment today. So, I wanted to talk about my numbness here. I am numb, like around here. This area here is like tingly kinda. But even though I'm numb, I have like a little sensation. Like when I get water, I can kind of feel a little that it's on there. I'm kind of like, oh, what's that? Or like when I touch it, or if I touch it accidentally, it's like I can feel it, but it's a weird feeling. It's like decreased sensation, kind of. Kind of feels like when your Novocaine is wearing off at the dentist's office, like that tingly feeling. I can drink out of a cup, and I can eat with a fork or a baby spoon. So I had a smoothie this morning, and I ate it with a baby spoon. And because sometimes when I get like drink, it gets down here, and I got teeth, and the gums hurt when it's cold. I think that's from when they do like all that stretching and stuff during surgery to get way back here. Sorry, I'm not talking that well yet. Well, this thing isn't going to come out for 4 more weeks. So this is how I will be talking. We'll see how that goes at work. But anyway, I have had some soreness, but I haven't taken anything for it. It's not unbearable. It's just kind of like annoying. I get spasms when I talk too much sometimes. Like, I'll open my mouth and I'll be like, oh, and it'll kind of like jerk my whole head. Even I get that when I'm not talking sometimes. I was laying in bed this morning and I got one of those things and it jerks my head. And I watched another podcast and they made it sound like, or not podcast, sorry, YouTube video. They made it sound like that's the muscle kind of relearning, like the new jaw. So that kind of makes sense. So anyway, day 13, I'm doing pretty good. Just can't talk very well. So I'm eating. I usually, with my eating, I just eat in the morning before I take my medicine. I try and have something like in the middle of the day. And then, or just at night. And I've really been eating mashed potatoes and gravy, juice, pudding, Jello. I had scrambled eggs last night with macaroni and cheese that I had to cut up to small pieces. So yeah, it's okay. The first 8-9 days was really hard, but now it's just this thing's annoying. And when I eat, it's kind of messy because I can't open my mouth that wide yet, even with my rubber band off. Ooh, I just got one of those pins. Even with my rubber band off, I can only open maybe like this much. So, and this thing is bulky, so it's kind of hard to get food in. But it's okay. I'm not like hungry anymore. Not hangry. So I'm 4 weeks a little over 4 weeks post-op. I saw the nurse practitioner at 4 weeks, and she loosened my bands, which you can see here, right here. I can take off still and brush and eat. She said everything was looking good, and she said I could chew soft foods like soft pastas and ground beef and ground turkey, even though I don't eat meat. So I tried to chew some like bread or like grilled cheese, and that just like got stuck like on my splint, because the splint covers my molars on the top, which makes it hard to chew. But last night I did chew a piece of pasta from pasta salad at work, and it actually like broke up into like pieces like you would expect, so that was really exciting. But what happens when I chew, it kind of falls to the outside of my mouth, and it's hard with the splint to get back into my mouth to like swallow it. But it was still exciting. The pain, since I made a video last time at 2 weeks, I was pretty achy there for a while at like 3 weeks. When I would lay down at night, they told me after 2 weeks I could lay flat in bed if I wanted. I would wake up pretty like swollen, which I'm still a little swollen now, like in this area. I would wake up and I would really need an ice pack just to like get the swelling down so I wasn't so achy. I went back to work during the 3rd week, at the end of the 3rd week. So I was 3 weeks and 2 days when I went back for the first day. The first day was kind of hard. I worked 10-hour shifts, and about a little over halfway through, I had some trouble. So pain hasn't been bad. I haven't really taken anything since, like, the second week. The first week, really, actually. My weight has gone up a little. The lowest I've been is 107, and today I weighed 110. My pre-surgical weight was 116.4, so I'm still down a lot. We have waited to alter my wedding dress because we figure once I can eat again, real food, I will gain weight back, which is a good thing, and I'll hopefully be able to go to the gym and work out some. My face is still numb on my lip and right here and to under my chin like this. But it's come back a little. I get these tingles and I can like feel this. It's just like numbness. It's just a decreased sensation. Kind of feels tingly when I touch it. My lip has come back the most. What else can I tell you? So I've been working. I've been cleaning the house. I still have low energy just because not eating as much as I normally do makes it hard to be able to spend those extra calories on doing extra things besides just your body functioning. So I'm still eating soft food. Eating with a fork is the easiest, or a baby spoon. I can use a regular spoon if I turn it upside down and kind of scrape it out with my tongue. But I prefer to use the baby spoon or a fork, unless I have really runny soup or something like that I can just kind of use a big spoon with, like, pour into my mouth. The majority of things I've been eating is mashed potatoes, soup. That's mainly it. That's the majority of what I eat. Lately I've had grilled cheese and just make it really soggy with tomato soup. And that is really good. I can kind of just cut it into little pieces and put it in my mouth and break it up with my tongue. That's actually pretty good. Yeah, that's about what I eat right now. Pudding. Oh, I like pudding a lot. What else? It's really about it. There's not a ton more new than that. I'm hoping that the swelling will go down all the way pretty soon. In 10 days from today, I go to get my splint out, so I'll be able to talk normal. So I'll show you how much I can open my mouth. I do have the rubber bands in, but it's about one finger still. I don't have any special exercises yet. They just told me to just do what I'm doing, and they said that how much I could open my mouth at my fork appointment was really good, which is about what I can do now, so that's good. So I'm going to try and show you a better view of my face. And I did a before and after comparison today on my phone. So, I'll be happy to show you. I still do have lip strain. I have lip strain. So, when I relax, my lips still don't touch. I had that before surgery. So I set it the sides like that. But I'm hoping once the splint comes out, that will help some. But she said it'll take up to a year for my lip strain to correct itself because my muscles are overactive from pushing my lips together all the time. So, yeah, that's about it right now. I'm hoping this numbness will go away, more so, because my lip gets, caught sometimes before I realize it, that I bite down, it really hurts. Because things are weird, kissing is weird, eating can be weird with it, numbness. So I'll let you know how that continues to go. But, overall, it's not been that bad. Just that first 10 days while I was completely shut was the worst. Since then, since I've been able to open and eat pudding and eat mashed potatoes and things that are a little more filling, and I can drink out of a cup, that has made a really big difference. And I just look forward to getting my splint out in 10 days. And for anyone who's looking, if you're going to have a surgery like this, from what I've watched on YouTube, it's not super common for people to have their splint in, like, where they can't remove it at all, and for the whole 6 weeks. And mine is an abnormally large one. I don't know if I showed you here. So it's pretty big, which is why I talk funny, and it kind of makes it difficult to eat. So don't let that deter you if you're having this surgery, because you probably won't have this big of a splint or have one at all, or maybe you'll have one that you can remove to eat and stuff. So yeah, but this splint is kind of annoying, I won't lie. I'm excited to have it out.
Smile, you're on camera.
Hi.
Sarah wanted an update, and today is how far in?
Almost 5 weeks.
Almost 5 weeks, and she's eating grilled cheese sandwiches.
They're soggy.
Soggy grilled cheese sandwich.
So I don't have to chew it. But it's better than mush all the time. Right?
And tomato soup. Let's get a look.
Before I go to work.
She's got her
I've been working.
sexy scrubs on.
And I go in a week to get this splint out. That's exciting.
Alright, put your head up, look forward. Now look that way. Nice. Looking good. That's looking good.
Soggy, soggy.
So take a bite, show us how it's done.
I can't right now. I don't want to show you this ugly. Starts off crispier than what I had intended.
As soggy as possible. Still no chewing allowed.
No, I can do chewing a soft food.
She can chew soft food. I'm a liar.
But it's hard with this splint on.
So here's how
Alright,
it
wanna
works.
see it? Dunk it.
Gotta dunk it.
Dunk it. Miss it.
And whoop.
And down it goes. Doesn't get cut up very much in my mouth. It's mushy.
Alrighty. Signing out.
Tomorrow will be exactly 5 weeks since surgery. And today I woke up and, especially right here, I had some like weird tingling, and all this kind of feels like the sensation is coming back, but like it feels weird right now. I'm sure it's normal, it's just like something to note. I am ready to have this splint out. So ready to have it out. It's just really annoying. And the smell I had the first week I had it in, I kind of had it the other day, and it really is gross. But 1 week from tomorrow, I will have it out. Other than that, nothing really new. I'm eating about the same. I was able to chew a noodle the other day, and I was able to eat spaghetti yesterday. I just cut it up in small pieces and basically just swallowed it. So anyway, I will check back with you. So today is my last appointment with my surgeon, and I get to get my splint out today. So I just got in the parking garage, and I have to go get a cone beam scan, which is a scan of my head, so they can see my skeletal system, my jawbone, and make sure everything is still lined up before they take out my splint. So hopefully when I see you, I will have my splint out, and we'll be talking a lot better. So now I'll tell you about weeks 7 to 9, and then I'll do a video of weeks 10 to 11.